Hi, my name is Ilene Schwartz, and I'm a professor at the University of Washington in Seattle. And my workshop here this year is about autism, and it's specifically about the DEC recommended practices, how the new recommended practices reflect on how we should be teaching young children with autism. So what I think about when I'm thinking about young children with autism, and what I say whenever I'm working with teachers or parents, is that young children with autism are children first, and that should influence every single thing that we do with the children with whom we work, the teachers who we train, and the parents who we work with. So that means that before we do any kind of intervention or any kind of instructional plan, that we should be thinking about what would this child be doing if he or she did not have autism. So what kind of toys would they be playing with? What kind of child care arrangements would they have? What kind of school would they attend? And then we want to say, now we have that piece of information, and then we want to think about what are parents' priorities? What are family priorities? And with those two pieces of information together, we want to go about creating an instructional program for children with autism. Now, when we think about what outcomes we want to achieve from that program, to us, all of our work is influenced by what we call a quality of life influence curriculum, which means that we're really interested in teaching skills and behaviors and tasks to the children that are going to allow them to participate more fully in their community. And that might mean their spiritual community, their school community, their recreational community, the community in which they spend time with their family. So we're really thinking about those kinds of functional skills. Well, how do we teach those skills to children with autism? Well, we know that teaching is an intentional act. So even incidental teaching is not accidental teaching, it's intentional. That means it's planned. That means we take data to demonstrate that children are learning, and that we look at those data to see if the instructional programs that we're using are working. And we need to do that on a regular basis. The final thing that I think is important and that came out of the workshop this year is that when we are planning instruction for children with autism, that we need to remember that it's not a solitary sport, that it's a team sport, and that we have to work with a full team. And the team includes families. And when we say families, we don't just mean mothers, we mean families. So that's whoever the family identifies as being a family. We should try to be sure to include siblings, because we know that siblings have the longest relationship with their siblings. And they are really wonderful sources of information and support for their siblings with disabilities. We also want to make sure that we have input from the speech pathologist, the occupational therapist, the physical therapist, whoever else, the general education teacher, whoever else works with the child with autism. And then figure out how we embed very explicit instruction, including explicit use of positive reinforcement into the instructional setting in which that child spends time.